Okay, now for Paget's disease, or also known as osteitis deformans, طيب. I try to simplify this disease as much as I can, طيب, because it's also one of the most commonly asked questions when it comes to MSK pathology. But that's why I wanted to just go forward and talk about the pinpoints that you need to look in the questions of the exam, on the questions in the exam, so you can be able to know that that diagnosis is Paget's disease. Okay. Now, for the pathophysiology, simply there is an abnormal function of the osteoblasts and osteoclasts. It is theorized that it is caused by virus, but nothing is confirmed. So it's not confirmed that it is caused by a virus, but it is theorized that it is. Okay. Now, for the most important features, guys. Okay, this is like where you get the question, you see these words and you be like, okay, that's Paget's disease. Okay, first of all, high ALP. We talked about in the osteomalacia video, high ALP is there because of osteoblasts. Okay, so whenever osteoblasts wants to function, they love to function in what? In alkaline environment. Okay, so when they want to function in alkaline environment, what do? They produce alkaline phosphatase, making the environment alkaline, okay? And therefore, they will function more and more, okay? So one of the findings you will see is in Paget's disease is ALP. But someone could ask, Rashid, don't we find that in osteomalacia as well? But let me tell you, in osteomalacia, we also find vitamin D decrease. We also see calcium decreased. We also see PTH is high. While in Paget's, you don't see these stuff, صح? So here right now, you can actually differentiate between the two diseases. And this is what we call differential diagnosis. So when we have high ALP, your differential diagnosis is going to be either between osteomalacia or Paget's. But how do we differentiate? We ask for lab findings that indicate for vitamin D, calcium, or PTH. طيب? If they were normal, Paget's. If they were not normal and they were decreased in vitamin D, calcium, and high in PTH, that could indicate osteomalacia, which again was explained in the video that I have put before this. Okay. Now, another very important buzzword that you will see in your questions is the mosaic pattern in histology. Okay. It's down there in your lectures, I think. If you go there, you can see the picture of the mosaic pattern histology. But I just wanted to straightforward give you the keywords. You see it in the exam, you put Paget's disease as your diagnosis, okay? So if you find the buzzword mosaic pattern histology with thickened tuberculi, this is very, very, very indicative of Paget's disease. Next one is the long bone chopstick fracture. So simply we have the bone. Again with my drawing, ya Allah. Okay, I'm sorry guys, you have to witness this. When there is a chopstick fracture, it means there's a fracture that the bone just peels off. That's called a chopstick fracture. This is when we have, or this is actually a command indicative of Paget's disease. This type of fracture is very common to Paget's disease patients. Finally, and this is very important, it can cause osteosarcoma. It is one of the bone diseases, actually, I think the only bone disease that can cause osteosarcoma, which is bone cancer. So bone cancer is related to who? Paget's disease. So if they tell you what is a bone disorder that is related to bone cancer, you tell them Paget's disease, and that's it. So these are the 4 buzzwords that you need to see that are related to Paget's disease. We also said that it's an abnormal function of the osteoblasts and osteoclasts, and it is theorized that it's caused by a virus. And finally, it's also known as osteitis deformans. And thank you so much. And of course, if you have any question, please drop it down in the comments. Thank you.